All right. Hello, everyone, and welcome. Thanks so much for taking the time to watch this short presentation. My name is Brian Cooper. I'm the manager with the Cleghorn Early Intervention Clinic, and I am here with my colleagues, Dave, Elias, Kelly, and Ali, who are all team members of the Cleghorn program. And we are here to give just a quick presentation around what psychosis is, how it's treated, how our clinic works, and just how you might be able to support somebody who might be early on in their recovery. And yeah, so our presentation today should be fairly brief, and hopefully we'll have an opportunity at a later date to answer some of your questions that you may have from it. So one of the things we often like to start off with any of our presentations is just to highlight the importance of trying to debunk some of the myths that people have around mental illness. And one of the things that we always really try to support is that mental illness is a lot more common than a lot of us may think, and that people living with mental illness enrich our lives each and every day. People might have seen the fact that about 1 in 5 people live with a mental illness, and lots of those people have gone on to do amazing things, and this is just a short little snapshot of some of the people who may have experienced psychosis in their lives. So the person on the left there is John Nash, who people might remember from A Beautiful Mind. There's Vincent van Gogh on the left, Brian Wilson from the Beach Boys on the top right, Jack Kerouac on the bottom. And I always really like that quote by Abraham Lincoln, who suffered from quite severe depression throughout his life, and just that thing, the tendency to melancholy is, to having depression. It's not a misfortune, or sorry, it's a misfortune. It's not a fault. So we always want to inform people that recovery from any mental illness is possible, and with the right supports that people can and do recover and lead very successful lives. So just really quickly, one of the first questions that we have to give an example of this, this is a short little video from, I used to work with a program in Nova Scotia, and we developed this website called BecauseYourMindMatters.ca that just describes psychosis. And these are actually real clips of real people who've experienced before. All of whom I knew and worked with. And so it's always a nice little snapshot into kind of really setting the framework for what recovery is, what psychosis is, and giving a hopeful message. So I'm not sure if we can pull up that video now.
Pretty much the thoughts I thought here were people ridiculing me.
It's like I was in a room full of people, but there would be nobody there.
Psychosis is a brain disease.
At first he thought he was psychic.
I was afraid all the time of everything.
It was scary.
Just like asthma is a disease of the lungs, diabetes is a disease of the pancreas, psychosis is a disease of the brain.
And it can cause people to feel very anxious or irritable or act in ways that they normally wouldn't.
It started off with withdrawing.
I always felt scared and followed and thought I was going to be put in jail or sent to Guantanamo Bay.
Then I started hearing voices. And sometimes they were men's and sometimes they were women's voices. Sometimes they would yell and sometimes they would whisper.
Psychosis can cause you to believe things that for others really absolutely don't make sense, but for the person with psychosis feels absolutely real.
So it just seems like other people aren't on their wavelength, can't understand what's going on. And someone that's suffering from psychosis, their friends and family often feel the same way too.
I didn't know how to cope with the thoughts that I was having. I didn't understand the emotions that I was feeling.
We worried about, whether she would be able to work, have a family, do all the normal, typical things young adults grow up to do.
It's an illness that's treatable.
So it's really important that we identify it early and get people help early.
A young person can go to a friend, go to a teacher, go to their family physician, talk about what they're experiencing, and that's probably the best and easiest way to sort of start that process of getting to the help that they might need.
You are not alone, that it is not your fault, and that seeking treatment is only going to make it better, and seeking treatment early is your best chance to recover and recover well.
There is help. This will get better eventually.
I just like to say to the people with mental illness, I think they should be proud of their struggle and what they've been through.
I remember before, might have seen someone that had mental illness and sort of and walk away sort of thing. Not now.
Okay, so hi, I'm Allie. I'm one of the nurses here at the Cleghorn program. So I'm just going to go through a couple slides, a little bit more detail about what is psychosis. So psychosis is a medical condition, like mentioned in the video. Psychosis in itself is actually a symptom. It's not specifically a diagnosis. When we look at psychosis, we kind of have subcategories, and we divide it into 3 different subcategories. So I'm just going to explain those in a little bit more detail. We have an analogy here of an iceberg, they placed positive symptoms on the top of the iceberg and negative symptoms and cognitive symptoms below the iceberg. So positive symptoms are something that is added and that can be visible to others. So examples of positive symptoms are things like hallucinations, hearing voices, seeing things. Maybe they can feel odd sensations on their skin, odd smells or tastes. Delusions, which are false beliefs. These include paranoia, feeling like somebody's out to get you or out to harm you. And then we can see disorganized thoughts or speech. People might not be making sense when they're speaking. Negative symptoms are when something is missing. So there's apathy, feeling like you're not as interested in things anymore, decrease in socialization, not wanting to hang out with friends or family. Some people see a restricted facial expression, so what often is described as a flat affect or a flat facial expression. Or sometimes there could be changes in people's speech. They could either talk really fast, or sometimes there's a slowness to their speech and there's a latency in response. Cognitive symptoms mean something's changed. So oftentimes we see difficulties in focus, attention, memory, and planning and organization. So this slide goes into those symptoms in a little bit more detail. There's they list a couple other changes that you might see, and at the top there you can see changes in mood, which can be anxiety, depression, sometimes irritability. At the bottom corner, they listed body movement. So sometimes people could actually look like they're walking slower. They could be sitting and like just staring blankly at times. And then on the other bottom corner, you can see changes in academic functioning. So especially with youth, you can see changes in school performance, or if they're working, changes in the workplace in terms of work performance. So clinically, we see psychosis in kind of 3 different phases. The prodrome phase is almost called like the pre-psychosis phase. So to the average person, you might not pick this up as being psychotic in nature. So what you could see is changes like mood changes, anxiety, changes in cognition. These are things that happen before somebody enters into the acute psychotic phase. And sometimes, unfortunately, we don't pick up on this until somebody's actually in the second stage, which is acute psychosis. And the acute psychosis phase is often where we see at our clinic our patients. That's usually the stage that they're at when we assess them. And this is when they're experiencing the hallucinations, delusions, disorganized thoughts, and speech or behaviors. And at this phase, this is where it's key that we start treatment immediately and as soon as possible, because the whole purpose of our program is that we want to catch people as early as we can in their illness and treat them as soon as possible to prevent future episodes and prevent having a chronic type illness. So that's why we try to see people within 2 weeks of referral to our program. And recovery is the third phase, which is a huge part of our program. I think Kelly will talk about that more in a little bit. And this is where once patients are already treated and feeling a lot better in terms of their symptoms, we really help them kind of reintegrate back into their life and work on their goals. So whether that be going back to school or work or coping with their diagnosis, reducing stigma, this is where we really work with the clients to kind of help them move forward with their lives. I think my colleague.
Okay, great. Thanks, Ali. This is Dave. I work at the Cleghorn program as well. Just want to go through the stress vulnerability bucket. So the stress vulnerability bucket is basically a way to explain why some people experience psychotic experiences. People who are extremely vulnerable, or to put it another way, people who are more likely to experience psychosis have small buckets, and those who have a low vulnerability are less likely to experience psychosis. So that's how I would explain the stress vulnerability bucket. I'm not sure how to go forward with the slide. Oh, there we go. So who does it affect? It affects, who does psychosis? Sorry, who does psychosis affect? It affects about 3 in 100 people, so it's as common as type 2 diabetes. It occurs equally throughout the world, regardless of race, culture, intelligence, background, religion, gender, or income. And the first onset occurs in young adults, roughly about 16 to 30 years old. First episode in females is generally a little bit later than in males. So for females, it's roughly between the ages of 21 and 25. And for males, it's usually between the ages of 17 to 21. There is no one cause for psychosis, but of course some risk factors are environmental influences, trauma, stress, genetics, physical illness or injury, or substance abuse or substance use. Sorry.
And I wondered if we might be able to hop back, because there's a movie for that slide.
Stress is a normal part of life. Effectively managing stress is important to feeling well and avoiding mental health problems. Stress overload is one of the factors that can trigger psychosis. We all have different capacities for stress in our lives. Think of this bucket as your capacity. Your bucket may be large or small. Everyone's is a different size based on their genetic and social backgrounds and events in their lives. See this faucet? It represents all the sources of stress in life: school, work, relationships, finances, moving your home, and so many more things. Stress results from positive experiences as well as negative ones. And nobody's life is stress-free. As long as your bucket can hold the amount of stress in your life, you're handling it all fine. It's when your bucket overflows that things can go wrong, so it's important to stop that from happening. Having a big bucket means you can tolerate lots of stress, or if it's small, you're more affected by stress. And while you can't change the size of your bucket, you can change the way you manage stress to reduce the flow, such as avoiding work overload or making time to relax. It's also important to have strategies for reducing stress so it won't overwhelm you. Positive ways of coping, like regular exercise, getting enough sleep, relaxing, sharing your feelings, or even medications prescribed by your doctor can help lower the level of stress in your bucket, like punching holes in it for the stress to drain out. It's also important to keep those holes from getting blocked. Using street drugs like marijuana or steady drugs, overusing alcohol, or not sleeping enough can be like putting corks into the holes. And sometimes, even without these stress factors, a person's stress vulnerability can be so great. In other words, their bucket is so small that even the ordinary stresses of day-to-day life can be too much. And when a person experiences more stress than his or her bucket can hold, psychosis can result. That's why it's important to recognize the signs of stress in yourself or someone you care about, and to take positive steps and measures that keep that stress from building up. The sooner, the better. Remember, your mind matters, And controlling stress is an important way you can protect your mental health along with your physical well-being.
Okay. Just wanted to give a bit more of an information around kind of what early psychosis intervention is in the work that we do. So the reason why there's early psychosis clinics, as you can appreciate, when somebody experiences psychosis, it can almost feel like their lives is turned right upside down. And one of the things that's really important is the longer people are experiencing these symptoms and don't get the treatment or the support that they need, the greater the risk is of things, occurring down the road that could really impede their ability to get their life back on track. So, if somebody's experiencing this, they might, drop out of school, they might break up with their partners, they might, have struggle at work. There's an increased risk of hospitalization, there's increased risk of suicide, substance use, ongoing disability, and potentially legal issues. So we really want to make sure we're cutting down that time as much as we can from when people start having those symptoms to when they get treatment and get that support and get their lives back on track. And so one of the old simple sayings we have is just the sooner the better, meaning the sooner that we can give people that support, the better. So how we do that at our clinic, which is the Cleghorn Early Intervention Clinic, we're at St. Joe's. We work with people, young people in the city of Hamilton who may be experiencing their first episode of psychosis and haven't had any treatment for that psychosis for a year or less. So we're really there to try to support these young people and work with their families as well to make sure that we provide specialized assessment, treatment, and ongoing rehabilitation to make sure that they get assessed right away and get those treatment supports right away. So we do work very closely with families as well as the young people themselves. And we are a time-limited program, so we work with people from usually 2 to 3 years to up to 5 years if the needs are there. So our main goals of the program is really we want to make sure that we prevent that disability. So again, we don't want people to become unwell and stay unwell. We do and expect people to, we do support and expect everyone who comes in through our clinic to recover and recover well, which means that they get their life goals back on track. So things like going to school and having a family and getting a job and all those sorts of things, we're there to support that. We want to make sure that, people, often medications is a pretty important part of what we do, but we want to make sure the medications people are prescribed are at the lowest level possible. We want to keep people out of hospital. Obviously, we want to do what we can to support people in limiting the risk around suicide, around substance use, those sorts of things. And again, just reemphasizing the sooner we can get people connected and support them, the better. So this is a very long list here, but just some of the work that we do, the way we support that. I mentioned that medications are a part of what we do. And that assessment is part of what we do, but it's a part of it. It's a slice of the pie. It's not the whole picture. And one of the things that's really important for the work that we do is that we're helping support young people and their families and all the different elements of their lives that's important to them. It's not just the medications. It's that we want to support you in getting back to school. We want to support you in kind of coming to terms with what you might be experiencing. We want to support you in your physical wellness, in your emotional wellness, all that sort of stuff. And so some of the ways that we do that is by offering certainly the medication management, but also we offer specialized support for family members. We offer psychoeducation, so recreation support, occupational support, social work. We do outreach with folks in the community. We're involved in a lot of research. We have a psychologist that can support what we call neuropsychological assessments. So if people are looking to get back to school, how we can support them there. We have supports around addictions. We run a whole whack of groups regularly, so lots and lots of stuff that we do to support that. And the whole aim of that is that we're trying to support the whole kind of picture of somebody and not just one element of them, because we know that that's where recovery is different for everyone, and recovery isn't just the absence of symptoms. It's really kind of, getting your life back on track kind of thing. So if you are interested, or if you know somebody who might need the support. The referral is available. If you go to stjoes.ca/Cleghorn, that's where our website is. The first step, usually, if you're comfortable with that, is to speak, if you have a family doctor, is to speak with your doctor. But we're always available if you need to call the clinic and just figure out if that might be a fit for you. We do have a centralized access service, so if you were to fill out that form, there's kind of a common spot that's also on our website that's linked there. For anyone who may, if this is a family member watching this, or if you yourself are not 100% sure, we can offer outreach to people if in advance of their first visit. Generally speaking, if somebody is referred to the program and it looks like they need to, it would be appropriate to assess them. That first appointment happens within 2 to 4 weeks, which we do have mandated standards of care. So that's one of the things that we're always aiming to see people as quickly as we can. And that first visit generally is about a 2-hour visit. And we do encourage young people in to bring their family to that first appointment. And we say family because that family is really defined by that young person. So a family could be parents, it could be a sibling, it could be a friend, it could be somebody that they work with. It's really what they define as it. But we know that family, your network, is really, really important to recovery. And the other thing to note is that if after that initial assessment, if it looks like you're a fit for the program, that those services start right away. So we want to make sure that you're again getting that support right off the bat. And I think, Kel, these are yours.
Yep. Thank you. So my name is Kelly. I'm one of the occupational therapists on the Cleghorn team. So I'm part of the recovery support team that includes Elias, our peer support worker. We have a social worker, rec therapist, and as well as another OT and an addictions counselor as well. So what we wanted to provide is some recommendations if you're concerned about a young person in your life, or perhaps you are trying to understand what's going on for yourself too. If you are trying to better understand or assess and engage a youth who may be experiencing psychosis for the first time, it's important to appreciate that psychosis rarely presents in these neat parcels, and it's unlikely someone's going to come to you and say, I'm experiencing these symptoms. So observation is key, or if you're getting the sense that something's not quite right with the young person. It's ideal to approach in a supportive, non-judgmental way. If you consider the symptoms that Ali spoke of, this person may be experiencing visual hallucinations or confusion as a negative symptom, so they might be distressed. If you can approach them in a non-judgmental, supportive way, that's ideal. And then ideally, they'll be more willing to come forward and talk to you about what their experience is right now. If you can, if you're not coming from a medical background, or even if you are, it's helpful to avoid kind of textbook medical language when trying to understand a young person's experience. So you can use words like, are you feeling more uncomfortable? Are you feeling worried about your own safety? You can ask if they're feeling more confused, maybe disoriented, but kind of starting general to understand if that person is having issues, and then try and zero in, if you can, on more specific questions like, are you hearing things that I may not be able to hear? You can kind of start general and then narrow in with your questions to try and understand what it is that they're experiencing. And also, if you have access, to ask family members if they're noticing changes, because the young person might not fully understand what it is they're going through, but if you can reach out to family members, they can provide more perspective on changes they might have seen in their young person, like mixed up sleep schedules, unusual behaviors. Maybe they're hearing their young person talk aloud when there's no one else around. And I'm having trouble skipping forward to my next slide. Thank you. Oh, okay. So when thinking about supporting young people with psychosis, with whatever their goals are, whether it's going back to school, back to work, or even just being more productive in their day, The message we try to relay is that recovery is very possible. It looks different for everybody, but we will use the phrase, we hold the hope for our young people that they can recover. We incorporate family at every opportunity that we can. We have our own family educator, nurse on our team, and also we're able to offer peer support through a lives role. And that provides a different way to help our clients appreciate that we have staff here that have also had lived experience with mental illness. It's also helpful to remember that psychosis is a brain disorder, and our brains control our perception. So it's going to take time for young people to adjust to the way their brains are thinking. They may have difficulties with concentration and thinking. And this is a change for them too, so it will take time. And also to understand that medications are a foundation of treatment. And a lot of people may have reservations or fears about taking medications for the long term. It can take a while for some clients to understand the importance of medications and also the side effects. We monitor these on an ongoing basis, but side effects can be challenging for clients as well to manage and get used to. And then supporting the reintegration, and I'm grateful for my role where I can help our clients get back to things like school or work. And part of my role can be assessing what clients are struggling with, and then partnering, reaching out to the schools or the employers to talk about accommodations or things that could help the young person be successful at work or school. And that could include some flexibility with deadlines, having somewhere to work if needed, a quieter space if they're having trouble concentrating, that kind of thing. And then support limiting of substance use. We have our own addictions counselor, and we work with our clients to create an open communication around substance use, but we know substances can trigger and worsen symptoms, so we work with clients who have a goal of reducing substance use to support their recovery and reduction in symptoms. So some take-home ideas. More than 1 in 4 families is touched by psychosis. And don't dismiss change as just an adjustment if you're seeing your young person as they make the transition from high school to post-secondary, or they happen to use some substances. If you're still feeling concerned or noticing something is different with your young person, it could be psychosis. It might be more than just that adjustment. So don't just write it off as a struggle to adjust. Paying attention to family, friends. These are people who can observe what the young people are going through. So it's important to notice and follow up if you are having concerns. And the message is that it's treatable, and we see success and recovery every day. We work towards early intervention. It's important and closely tied to recovery. And as a team, we also work to be culturally competent in our care and considering our clients' backgrounds, where they come from, and their beliefs as we work with them to partner in their recovery. And is that, I'm going to pass over to Elias now to share his experience.
Awesome, thanks Kelly. So like Kelly said, I'm the peer support worker at Cleghorn, which means I have my own lived experience of going through psychosis and making it to the other side, so to speak. So I'm going to tell you a little bit about that right now. So I'll start off with like a little bit of context and a bit about the prodromal stage. So for me, entering into psychosis wasn't something that happened overnight. And there was a lot of little tells that things were going wrong and that something was up, but that I couldn't quite pick up on because I wasn't sure what to attribute them to. A lot of it was like a lot lower mood, increasing my substance use, isolating from friends and family, and really just having a hard time connecting with people. And as this started to progress and it started to like fuel a disconnect from society, my substance use got worse and worse, and it tended to mask the things that might have been like predictive of, or been able to let me predict like what was happening. So there'd be little things that pop up, like little thoughts that I'd have that I couldn't quite explain, things that weren't necessarily connected to reality, but that would go away relatively quickly once I sobered up. So I just kind of like pushed it under the rug. And eventually these started to develop until I started hearing like a voice that would tell me to do things. I started to think that the police were after me. I started to think that there was a whole bunch of like conspiracies going on, and I thought there was like a group of people out to get my family, and it was really scary because even in all of this, my mood went up and down, and I had no idea what was going on. It was very confusing, and having isolated from people, there weren't as many people who could have been like, oh, like, Elias, there's something going on with you, so maybe we should check up on that. And eventually this all ended up with me in the hospital. And the hospital is actually where I got connected to my own epi team, early psychosis intervention team. And it was there that I really started to like figure out what was going on. So when I was in the hospital, I was diagnosed with psychosis, and when I was discharged, I was connected to an early psychosis intervention team, and they really helped me to figure out what was happening. And I like to say that it took me a good 8 months to a year to actually process the event. So in that time, I tried going back to school, I tried working, I tried a whole bunch of different things, but I kept coming back to like, what did this mean in my life? Did this really represent a big change? And like, how could I go forward from this? So after spending a long time trying to figure that out and trying to like discern who I was now and if I was a person who could live a meaningful life, I started to enter a bit more into recovery. So through connecting with my epi team, I was able to work out that there may have been a big change in my life, but I was still the same person. I was still capable of like achieving my goals, and I was still able to like live a meaningful life. So I wrangled my substance use under control. I started to really connect therapeutically with a bunch of people, work through my emotions, develop positive coping skills, and I ended up going back to school and learning how to be a peer support worker. And after doing a few talks, I ended up at Cleghorn, and so I ended up here. Yeah, and I think that's all we have for today. So, speaking on behalf of everyone, I'd really like to thank you for taking the time to